Welcome to a new episode of Beyond Neglectic, the podcast by Anesvad Foundation, where we explore the stories, challenges, and solutions shaping global health. Health is health here in Spain and in the most forgotten places in the world. But the reality is that not everyone can access health in the same way. And understanding that inequality is often the first step towards changing that access to health. At Anesvad Foundation, we believe that when people become aware of the barriers affecting the right to health, something shifts in their way of living. Awareness can lead to engagement, and engagement can lead to a real transformation of communities. That's why, alongside our work on the ground in Anesvad Foundation, we also see education as a key driver of change. Not education understood only on the transfer of knowledge, but also as a process that invites people to question, reflect, and understand the world from a broader and more connected perspective. We do this work by working together also with organizations, schools, communities, and public and private actors, which are fundamental for connecting networks and amplify, of course, the impact of those networks. But what does really mean that application of education in practice in the local and global communities? It means encouraging critical thinking, encouraging education processes, and that's why today we have these wonderful participants in our podcast. Emmanuel Mintah, he's Executive Director of Ark Development Organization, ADO, from Ghana.
Yeah.
Thank you so much for coming today.
Yeah.
And María González Sevilla, she's Education Specialist at Anesvad Foundation. Thank you for coming, María.
Yeah.
First of all, I want to introduce
Yeah.
the connection between education, awareness, and global health inequalities.
Okay.
So when we talk about neglected topical diseases, NTDs, education is not usually the first thing normally that comes to mind, no? If we speak publicly about NTDs.
Yeah.
Why should be part of the solution? Why should we speak actually about education as maybe not the first or the second, but as a priority in changing the NTDs approach?
Okay. ¿Cómo está? To Mabio. My name is Emmanuel Mintah from Ghana, as we speak as a data for Ark Development Organization. When most people hear neglected tropical disease, they think immediately of drug treatment, medical intervention. And yes, those are essential, but at ADO, we have seen time and again that without education, even the best medical intervention falls short. In the communities we work across Ghana, skin NTDs like brucellosis, leprosy, elephantiasis, yaws carry enormous stigma. People hide their symptoms because they fear rejection. They don't seek care because they don't understand what is happening to their body, or because their communities have attached shame and superstition to this condition. Patients are sometimes accused of being cursed or bewitched. Families keep children home from school because they are afraid of judgment. So education is not supplementary to the solution. It is part of the solution. You cannot eliminate a disease if people will not come forward for treatment. You cannot build sustainable health system if communities do not understand their own right to health. Education is what bridges the gap between drug in a health facility and the patient who actually takes it. Under our Empowering for Communities for the Elimination of Skin NTDs project, community education was central from the very beginning. Not an afterthought, but a fundamental pillar of our strategy in the implementation. Thank you.
Of course, education is a fundamental pillar, and I think it's something we must be aware of when we tackle NTDs, of course.
Yes.
In your case, Maria, why should education be part of the solution? Like, what's your strategy or approach around that?
I would say that, as my colleague was just taken to the place, education matters when we talk about entities because we cannot see them just like a medical issue. It's an inequality problem, and this is related to poverty, lack of access to water and sanitation, to housing, to so many things that are relevant for the developing of a wellness and a good life for each one, that I think that education, what takes in something good, is letting people understand in a better way all the problem that carries suffering from some of any of these diseases. So I think that for us in the foundation is really relevant to try to make this approach, not just to think about it as just a health medical problem, but as something that is related to poverty and to all of the parts of your life.
Sure. Like, education is something so structural, no? And like poverty is like part of the structure. And maybe the way to tackle NTDs and other issues like around the world is tackling the structure of poverty and the structure of the education, like from the basis. Also, I think there's something quite important, which is children and youth. As agents of change. We have been seeing like worldwide how youth and young people are changing many social movements and putting like central transformation as a priority in their lives, no? So in your opinion, like from your work and from Anesvad Foundation, why is it important to engage children and youth in conversations about NTDs and in conversation about global health inequalities? Why are they important nowadays?
Thank you very much. Children, simply the future citizens. Tomorrow we may not be around. So if we are not giving them the first-hand information, how can they sustain? How can they continue the good work our leaders have started? They are present citizens, and in communities where we work, they are often sometimes of the most powerful messengers. Children, they do send a lot of message to their parents, and when they say that parents listen to them rather than health officials giving to them. So at Ark Development Organization, in our projects, we engage young people directly through schools and community youth. They are most of the champions, community youth groups, organized groups. We train them not just to receive information, but to become community mobilizers themselves. What we discovered was remarkable. When a child goes home and tells their parent, "Mama, I learned today this disease is not a curse. It's not a bewitch. There is a treatment at the health center." That message lands differently than when a health worker says the same thing. It has intimacy with the parent. It has trust. It crosses barriers that formal health communication often cannot. When children are excluded from the conversation, we can't reach anywhere. We make the critical channel to send the message across. We have seen children with skin diseases bullied from school, rejection, isolated from their peers. When we bring education into those schools, not just for the child who is sick, but for whole classroom or the whole school, we shift the culture. We transform the environment from one stigma to one of the solidarity. The rare capacity children have to drive change is not theoretical. We have seen it. Young people who participated in our community education session become advocates in their own homes and neighborhood. That is the multiplier effect. No clinical intervention can achieve that. This is why we include children in our implementation. At times when we design the intervention, we involve them. We go to the communities. We engage the major stakeholders, the gatekeepers. Then we engage the children also to hear their voice before we design the intervention. So when you start implementation, very beginning, you have to involve them. And they will send the message across. They will send the message across. Thank you, Anesvad, for the support you give us. And we are able to make a lot of impact within our communities. And children are driving the change. The survivors are driving the change. That is why with that involvement, they are the future leaders. Tomorrow I may not be here, but my child will come, my daughter will come and continue. Thank you.
That's so important, everything you say, Emmanuel. I think it's like the key change of everything is youth and childhood, and being conscious of that from your community and from your organization. It's like a huge step on progress and evolution. So congratulations for that.
Thank you.
I think it's super great.
Thank you.
Maria, in your case, what do you think about using youth?
I will add in this moment that they are actually shaping the world. Sometimes we think about children or youths as the future leaders, but they are actually living in this society. So they actually have experiences and knowledge, questions. So why keeping them out from the conversation or whatever? They can maybe start to approach and to understand this problematic, no? So also taking into account that nowadays we are globally exposed to so much information every day. So I think that education has the opportunity to transform that information into awareness, into knowledge, like something that you can have a conversation with someone, but having proofs, having some data that is real. And I think that youth and children have the opportunity to learn all of that and start making that changes in our societies. I think that if we take them out of the decisions, we are losing a really big opportunity. Emmanuel was saying this, in the future they will be here, but if we start now making or letting them have more questions and have a mind more critical, in the future we will have maybe more empathetic people, more people aware of the inequalities that are involved in our world. So in the future, maybe there will be someone that is going to be trying to resolve all these problems, I think.
We can say also like the future is now, actually. Normally when we speak about youth, we're like, they're like the future. No, they're already part of present life. Of course, they will be in a future life because, life is life. But future is now, and what they decide now it will determine future.
Yes.
I also, Emmanuel, wanted to ask you another thing related with some initiative you have in ADO. Which is the WASH Champions. I think that's fantastic. Maybe you can speak a bit about what is WASH Champion.
Okay, thank you very much. Like the question you asked earlier, without involving the children in anything you do, you have already failed already. So as part of the implementation of empowering communities, we have come out with some innovation using the children to lead. So we call it a children-led WASH activity.
Okay.
Looking at our area, there's a lot of sanitation issues. and how to solve it is very key. So the children, they have a lot of potentials. So we came out with some design with the Ghana Education Service to do some quiz within the communities and also engage them to come out with innovations that can solve the problem they have within their school. Because at times the school sanitation is also a key in the communities. So we have done the first activity. We are going to do the final, and we are going to give them some seed amount to start the intervention. So it is a good initiative that we have started. Most of them have come out with some tools that they can use to clean the environment, and they want to solve their school issues. So we have about 13 schools who apply for this award, and we selected 4. They are going to face the final, and they are going to use this one to drive the change. Even the other people who are not successful, we are also engaging them, and we have write some proposal to other organizations to support them, because we are going to support the 4 schools to go further. But the rest of the schools, we are going to support. We have wrote proposal to the organization to also support them to come out with their innovations. And we have started one community, the place that you came the other day to do your activities, Akrabo. They have started. The community and the chiefs, they have come together because they are coming. It's very innovative that they can use to solve their issues within the communities. So youth is critical component of our interventions. Without them, you can't, because a behavior change. Because when they start, we, the adults, we have already, to change our behavior is very difficult. But the youth, when you inculcate this into their mind, they can grow and change the attitude. That is why we are engaging them to come out with this innovation to solve their sanitation issue, to solve their wash eating within their community and the school area. So these are the things that we are planning. And very soon, by the end of this year, we will come out with some successes to Anesvad. Thank you very much for supporting the youth to come out with innovation that can drive change in their communities and across Ghana. Thank you very much.
I love this initiative because it encourages children and youth going to school, and at the same time you're educating youth on sensibilization around water consumption and using wash conditions to prevent NTDs. Both things are interrelated, and it's so cool. I love it. So congrats for that work.
Because at times, the girl child, when they have their menses, the school compound is not conducive. So they are going to solve all this problem. That is why some of them have designed a proposal to solve those issues. They have to get a special period for the girl child when he have his menses. At times when you have menses, you don't go to school. You have to stay house until you are maybe 4 or 5 days or 7 days before you can start. And this one will impede the education of the girl child education. And a woman is very powerful. If you don't have a strong woman, you don't have a home. So that is why you have to prepare them at the young stage so that they can face the future. Thank you very much.
Also, I want to open the conversation beyond formal education. Because schools, of course, they have a very important role on tackling NTDs and like sensibilization and using the school community ground as a scenario, for organizing community-based organization and activities. However, I think like there's something much more wider, if we speak about education, that does not only happen in schools. There's a huge important role on communities, on the paper and the role that community play on the awareness around NTDs, in addressing NTDs. So my question is, what role does actually community awareness play in NTDs prevention on NTDs as a concept even?
And when we tackle the school, we have to tackle the community youth also. So we have community youth champions. We have also trained them to drive or to lead the change at the community level. So, and we have also engaged the community groups. We have other clubs. We have other associations, because we have to look the citizen structures to drive your intervention. When you go to the community, you have to look at the dynamics. You have to scan the environment and look at, because you cannot dump the intervention to them. It have to be top and down approach. It should be top and down approach. So we use the community strategy, engaging them. Then we just make them to make informed decision to drive the change that they want to embark upon. So these are some of the strategies, and we are able to form 10 community foundations as a pilot in one of the communities. They come together as a sustainable way to sustain their project. So we have formed community foundation, conscientize them to understand that they have to own their own development and their own health. So they meet, we train 15 key youth leaders, women and disability groups, that they are planning for the community activities. They do fundraising. I think we send with some of the this, and they do fundraising activities as and when the need arises, then to support the awash intervention within the communities. So the youth in the community play a critical role. And the chiefs, the queen mothers, they also support a lot. They are the gatekeepers because they have to buy into the idea. We are just doing social mobilization and support the communities to see the community culture and community dynamics so that you can pave your way through. Other than that, you cannot make your way through, and you cannot achieve anything as you expected. Thank you very much.
In your case, Maria, what role does community play on NTD prevention?
I would say just, Emmanuel was perfect. I think that it is going to be difficult to add something new, but I think that I'm going just to reassure on what you said. For us, community is essential in what NTDs has to do. Is the best way for raising awareness. The idea of collectiveness is fundamental on the work we want to do. I mean, if you want to change health behaviors, if you want to talk about the stigma, if you want to talk about social perfection on NTDs, the community is the key for making those changes. So I think that it can be something complementary, no? Just not in schools, but also in communities, families, something more holistic, or where everyone has their own moments or parts to see how to contribute in the wellness of the in the community and each person, no? Because if you are well, your family will be well. It's something like it goes like in a chain, I would say. So also, the communities have already the knowledge, they have the experiences and different strategies that they can be just shared in common. And you can also learn from someone that has been previously suffering from the same thing, or from new ideas, or if you have someone younger or someone older, that information goes from one part to the other. And I think that also that is very important in this case.
Yeah, sure. You were speaking about stigma, stereotypes. ADO has, I don't know how many programs around stigma and stereotypes. Can you explain some of them if you want, and how and why is it important to tackle stigma and stereotypes in community-based approaches?
Okay. When we talk about NTDs, neglected tropical disease, at their core, a justice issue. They are proportionately affect poorest communities. Communities with limited access to clean water, sanitation, healthcare, and economic opportunities. That is not coincidence. That is the fingerprint of systemic neglect. In our community's education work, we are deliberately about making those connections visible. We do not just say, here is the disease, here is the drugs. We ask communities, why do you think this disease is more common here than in wealthier areas? What does that tells us? how our health system is designed, whose health is treated as a priority, and those is not. These are not comfortable questions, but they are necessary one if you want communities to move from passive recipient of health services to active advocate for their own rights. Our stereotypes. This is where education can be genuinely transformative, but also where it requires the most care. Stigma around skin entities is deep and culturally embedded. You cannot challenge it with a poster. You can challenge it, sustain relationship through testimony, through creating space where people who are affected can be seen with their full humanity. We have used contact-based education, using the community volunteers, bringing people who have experience and recovered from skin entities into community conversation. Recently, your team came and visited one of the clients. He was given a lot of testimony. And he have able to refer most of the clients to the health facilities, giving us call, then we make follow-up. They are now agents of change. They are now agents of change. So it is very important in our work to include all those people, to break the stigma. Because when the person recovered and now is doing advocate, showing the situation, because the man have spent a lot of about a year in a shrine, in a prayer camp, paying so much money, still not recovered. But when they meet Ark Development Organization through our volunteers with the support of Anesvad, now he's an advocate. He has recovered, referring people to the facilities for care. Thank you very much. Thank Anesvad for the great work that you are doing. Because we look at how BU is, at times it's very difficult and very offensive. Near that person is not easy. So the stigma is great. If you sell something, they will not buy nothing and your livelihood. So underlying factors is very great. After recovery, hot nest. So as part of our intervention, we try to do economic support for those people to also start life. Because the man was a mason, at the same time as an electrician, you have those skills. But because of the BU, you have to stop. So we see the power of the education and the Anesvad support have helped this guy to recover. Currently, it's one of those we are considering to empower them, to give them some support so that they can start life again. Thank you very much.
The importance of active, like listening actively
Yes.
to communities makes a change.
Yes.
Because the guy you were speaking about now, if he hasn't had the space to be listened to, probably he would be still trying to, stigma will still be around. And that also like makes big barriers on social life and economical life and so on. So I think it's fundamental.
They have to cause suicide. When the stigma is great and he cannot come isolate himself and then they have to cause suicide.
Sure. And in your case, Maria, what kinds of misconceptions or social barriers encounter when we speak about NTDs? What are the main stereotypes on NTDs?
Well, I will say that stigma still is one of the biggest barriers talking about NTDs. NTDs, we call them neglected. This is not accidental. This is structural. This is structural because of how the world is thinked or how it's made. It's something that has to do with health inequalities, and this is absolutely linked to economical, political, and social inequalities. So I would say that this stigma related to these diseases is something on what we try to focus a lot. I think that there is a lot of work still to do. The way you don't want to go to the society because of what you are having the fear of not being accepted, I think it's sometimes more problematic than the disease itself, no? In the end, a disease you can treat hopefully with drugs or making more research and knowing better how to evolve on this. But the part that has to do with your social life, everyone wants to have a good life.
Yeah.
So what it has to do with the social part is fundamental.
Yeah.
And I think that in the foundation we try to think that when we work with people making projects, that part is completely taken into account, because if not, we will left many things that wouldn't be a good work, no? I mean, not in communities, not with the people.
Yeah.
At the end of the day, that's part of humanizing people, right? Not like just an entity as itself, who is behind those entities.
Yes. And I think it's also a matter of justice, dignity, humanity, empathy. So
human rights.
It's just that, no? I mean, it's entities, but in the end, it's talking about your right to health and talking about human rights. So everyone should have that opportunity, or not because of where you have been born or the country or the government you are in. You're going to have more or less access for having a better health or just having one. So I think that I would say that it's just a thing of justice.
Of course. I want to start finishing the conversation.
Okay.
And look onto the long-term impact of NTDs and the way we collaborate with NTDs. And of course, the impact of education if we speak on long-term perspective.
Okay.
So normally the impact of education is often long-term, actually. And quite difficult to measure and to the perspective are quite more difficult to tackle and to report. However, from your work in Ghana and from your work in Anesvad Foundation, how do you evaluate education in a long-term impact?
Okay. This is a challenging.
I know, sorry.
That is very, it's very challenging. This is very challenging. Organizations working in this space grapple with. Funders often want numbers. How many people were trained? How many sessions were held? How many children attended? And those numbers matter. But they do not tell the full story. What we have tried to do at ADO, that's Ark Development Organization, is to track behavior change over time, not just knowledge acquisition. The people who attended our community education session actually present when children are excluded from this conversation. We miss a critical channel. We also miss an opportunity for children who may themselves be affected. And many are to understand their own condition without shame and to know that they deserve care and dignity. So we measure this impact, like I said earlier, we cannot measure in that because it's their behavior. So we have to look at how the people behavior, how people attitude happen over time. You cannot base on numbers. You cannot base on how many sessions, like the funders are looking at for indicators. They'll give you indicators, how many sessions, how many numbers you train, how many days you train. But really looking at beyond that, the behavior. Are the people behavior change towards the people living with skin entities?
Of course.
We can use that one to measure. But when you go to the community, you see that the stigma have reduced. The discrimination have reduced. People are solidarity with people living with skin entities. This is where you can measure. So when you come to the community, you have to how the community are supporting the support system within the community. How are they putting things in place to support people living with skin entities? So this is where we also use to measure our impact. And you cannot just go to community just one day and you are expecting impact. You have to deepen the conversation. You cannot just parachute in one community within 6 months or 1 year, you say you are out. Our strategy is consistent visiting communities with over years, a year, 2 years, or 3 years, before you can measure impact, before you can see behavior, because behavior cannot change just overnight. It has to be continuous to engage the communities, to change their behavior towards our system, the strategy that we are putting in place. So these are some of the strategies that we use at Ark Development Organization to measure the long-term impact within the community. So when you support organization within just 1 year, 2 years, you cannot see more impact. It has to be continuous. Maybe you can measure 5 years. 5 years, if you want to come and do impact assessment, you have to take these indicators into consideration. Then, yes, this community have really transformed from its beginning. So these are what we use. So we are deepening the conversation. So in the next phase, we are designed, because we have documented some lesson learned that we want to use to impact the communities more. That one will help us. At the end of the intervention, we can measure some impact. Thank you very much.
Thank you so much.
Yeah.
So important. You were mentioning the prioritization of qualitative things and not so much quantitative issues. Like the importance is not so much on how many sessions I've done, like how those sessions have been impacting communities, in which way. So that's fundamental. And thank you for your work. Anesvad is going with you, but the work is like from communities and from local initiatives. So thank you so much.
Okay, thank you.
And from Anesvad Foundation, how do you understand long-term education analysis?
I think that's the word, long-term, and a question of patience. I think that we have to assume that we are not going to be seeing results immediately, that we have to believe that what we are doing has sense and that we are doing it well or at the best we can. So that critical awareness is going to be developing and really getting into the minds of the people that we are working with. I also may say that I think that there are also indicators that we can take into account. I will agree with Emmanuel that maybe not so many quantitatives, but also qualitatives are those ones that are relevant. And I will say that sometimes you can see the change because of the questions that the people are asking. So maybe if they didn't even know about the problematic or these diseases, the first idea is like, we want to help. But when they understand what it really means, maybe they are not trying to help. They are getting anger, they want action, and they want to be part of this and be part of the solution. They make another kind of questions and they have another critical idea of why this is happening. So I think that this is also something that you can be observing, like how these little steps are, making sense on what we try to do. And also I would say that sometimes these initiatives, this impact, we will see them in the future. Maybe it's not that they are going to disappear or that the stigma will never be related to this, but maybe thanks to the education, you will have someone studying, you will have something or someone interested into NTDs. You may have someone that knows who to vote, so someone that can be engaged in their society. So I think that these are the social changes that we can expect thanks to education.
Of course.
Great.
I would love to keep speaking with both of you,
Yeah.
but we need to finish.
Okay.
Rules are rules, and we
yeah.
must accomplish the rules. So thank you very much for your work, for your time, and hope to see you soon, maybe in Ghana.
Thank you.
Please, thank you so much. And thank you for joining us on a new episode of Beyond Neglected. We'll see you again soon in another episode. Thank you.